You wake up. Your mouth feels like you went to sleep with a handful of sawdust in it, thick, sticky, and uncomfortable. You reach for the water on your nightstand, take a sip, and move on without a second thought. Just another morning. Getting older, right? Well, I need you to pause right there, because that assumption, that quick dismissal, that 5-second choice to ignore it, could be one of the most important mistakes you make this year. I'm Dr. Michael Kent, and I've spent decades in clinical practice watching people brush off symptoms their body was clearly trying to warn them about. Morning dry mouth is one of those signs, and I understand it may sound almost trivial. Dry mouth, not a heart attack, not chest pain, not an obvious lump, just dryness. But stay with me, because by the end of this, you'll see that morning dryness in a completely new way. There is a chain reaction taking place inside your body when this happens, and it begins long before you even wake up. Understanding, it won't just make your mornings easier. It could help protect you from pneumonia, from infections that enter your bloodstream, from losing teeth you've had for decades, and from a decline that no one noticed because attention was focused elsewhere, while the real issue stayed hidden in plain sight. This is not a small inconvenience. It's your body raising a warning signal, and today I'm going to explain exactly what you can do about it. So let's start from the beginning. Let's talk about something most people have taken for granted their entire lives: saliva. I know no one wakes up thinking about saliva. No one goes to their yearly checkup and asks how their saliva is functioning. It's just there. It has always been there. And like many things that are always present, people don't notice it until it's gone. But stay with me, because once you understand what saliva really does, what it contains, and what it is constantly doing inside your mouth every hour of the day, you'll never look at it the same way again. Most people think saliva is simply diluted spit, something your mouth produces so food doesn't stick, something that appears when you smell something delicious. That idea is incorrect in many ways. Saliva is one of the most complex biological fluids your body creates. It's not just water with a small addition. It's a carefully produced biological solution that your body makes continuously, day and night, through glands specifically designed for this purpose. And what it does with that fluid is impressive. Think about what it is accomplishing every single hour of every single day. It is constantly working. Your saliva is filled with antimicrobial compounds, proteins called immunoglobulins, enzymes like lysozyme and lactoferrin, and peptides with names most people rarely recognize. All of them operate together to detect and neutralize bacteria, viruses, and fungi before they can gain a foothold. This is not passive. It is an active biological defense taking place continuously in your mouth without you even noticing it. Every time you swallow, and you do this hundreds of times a day without thinking, you are pushing a wave of biological protection through your mouth, sending those pathogens down into the acidic environment of your stomach where they are destroyed. Without enough saliva, that process fails. The bacteria are not cleared away. They remain, they multiply, they form colonies, and your mouth turns into the type of environment that doctors describe with very serious terms. And it doesn't end there. Saliva is the starting point of digestion. It contains enzymes, amylase being the most important, that begin breaking down carbohydrates as soon as food enters your mouth. Before it even reaches your stomach, the process is already underway. When you chew and saliva mixes with your food, you are not only softening it mechanically, you are starting a chemical process. When saliva levels are low, this process is disrupted from the very first bite. Food reaches your stomach less prepared than it should be. For older adults in particular, where nutrient absorption already needs close attention, where stomach acid production often decreases naturally, and where digestion is less efficient than it was at 30, this early disruption matters far more than most people realize. Saliva also helps maintain the pH balance in your mouth. After eating, acid levels increase. Bacteria produce acid as they break down food particles. Your enamel, the hard outer layer of your teeth, is vulnerable to that acid. Saliva acts as a buffer. It neutralizes acidity, restores a safer environment, and gives your teeth a chance to stay protected. Without enough saliva, that acid remains longer. It stays in contact with your enamel, and that extended exposure is what begins tooth decay. People with dry mouth do not just develop a few extra cavities, they can experience a rate of tooth damage that is surprisingly high compared to what they are used to. But here's the key point you need to understand. The reason dry mouth in the morning is especially dangerous is this: saliva allows you to swallow safely. Think about it. Try swallowing right now. Notice how smooth the process is. Your saliva coats everything and helps it move in a controlled and coordinated way. That is not by chance. It is a precise biological function. The food you eat must be formed into a cohesive, lubricated mass that your throat muscles can move in one clean, direct motion. Saliva creates that structure. It binds food particles together, coats them, and allows the entire mass to slide through your throat and down your esophagus smoothly. Now imagine trying to swallow dry bread, a piece of chicken, or a handful of granola after your mouth has been dry for 8 hours. The food does not form that smooth, unified mass. It breaks apart. It becomes loose and unpredictable. Small pieces separate from the main portion. And that unpredictability, as I will explain shortly, is where the real risk begins. The medical term for chronic dry mouth is xerostomia, xerostomia. It is not just a feeling. It is a measurable reduction in saliva production that leaves your mouth without its primary defense system. Doctors can test it. Salivary gland function can be measured, and when those levels fall below a certain point, the consequences we are discussing become much more likely. Each night you sleep while your mouth dries out, you are resting without your natural protection. Your oral environment shifts from a balanced ecosystem where different organisms exist in controlled harmony to something closer to an unmanaged biological condition where the most aggressive and harmful species take over because the system that kept them in control is no longer functioning. That sticky feeling in the morning is not just uncomfortable, it is the evidence. It is the physical sign left on your tongue and the roof of your mouth that your defenses were lowered all night and things were taking place there that you would not want to examine under a microscope. So, who is responsible for this? What is actually causing it? And here is something important to notice because it is rarely just one reason. It is almost always a combination, a kind of perfect storm of factors that build on top of each other and intensify one another's effects. And when you hear them, I think you will recognize yourself in at least one or two, maybe even more. The biggest contributor for most adults over 60 is medication, not one specific drug, but the buildup of medications. There are over 500 commonly prescribed drugs that list dry mouth as a known side effect. 500. Blood pressure medications, antihistamines, antidepressants, anti-anxiety medications, muscle relaxants, medications for bladder control and overactive bladder, medications for Parkinson's disease, certain pain relievers, some diabetes drugs, diuretics of various kinds. The list is much longer than most people expect, and here is what makes it truly complex. Each of those medications on its own may cause only mild dryness, a slight decrease in saliva that you may not even notice. But when you are taking 3, 4, 5, sometimes 10 or more at the same time, and that is not uncommon for adults in their 60s, 70s, and 80s, those effects do not just add up. They multiply, they layer. They interact in ways that your prescribing doctors, who often see you in different specialties, different offices, and on different days, may not track as one complete picture. They disrupt the nerve signals that tell your salivary glands to produce. They change the composition of the saliva that is made. They affect blood flow to the gland tissue itself. Think of it like a factory where the order forms keep getting misplaced, the supply deliveries keep getting delayed, and half the workers have been reassigned elsewhere. The machinery is still there, the capacity still exists, but the instructions are not arriving consistently. The raw materials are reduced, and production slows to a fraction of what it should be. Maybe you have noticed something like this without fully connecting it. You have been on a medication for years, and your mouth felt normal. Then a new prescription was added for something unrelated, and gradually, not overnight, mornings began to feel different, drier, stickier. That gradual change is one reason it often goes unnoticed. People do not link the new medication to the new symptom because the connection develops slowly. And because we are told to expect certain side effects and dry mouth sounds so minor, it rarely makes it to the top of the list of things to report, but it should. It absolutely should. The second major cause is how you are breathing at night. During sleep, you should be breathing through your nose. Your nose is designed for this job in ways your mouth is not. The nasal passages filter incoming air, removing particles and pathogens. They warm the air to body temperature before it reaches your airways. They also humidify it. By the time air that enters through your nose reaches your throat and lungs, it has been processed and conditioned. Your mouth skips all of that. If you are breathing through your mouth during sleep, whether due to seasonal or chronic nasal congestion, structural issues like a deviated septum, enlarged adenoids, severe allergies that swell the nasal passages, or something more serious like obstructive sleep apnea, then for 7 or 8 hours every night, dry, unfiltered, unconditioned air moves continuously across every moist surface in your mouth. Imagine leaving a shallow dish of water on a breezy windowsill on a dry day and returning 8 hours later to find it nearly evaporated. That is essentially what is happening inside your mouth. Moisture is pulled away by continuous airflow. The saliva that would normally coat and protect your oral tissues cannot keep up with that evaporation. It dries out, and what remains is a warm, dark, increasingly dry environment that anaerobic bacteria, the type that thrive without moisture and produce the most harmful compounds, find ideal. Sleep apnea deserves special mention here because it connects dry mouth to a much larger discussion about overnight health. People with untreated obstructive sleep apnea breathe through their mouths not just by habit, but because their airway repeatedly collapses during sleep. The body compensates by opening the mouth and working harder to breathe. If you snore heavily, wake up often during the night, or feel unrefreshed in the morning regardless of how long you slept, these can be important signals. If someone has noticed that you stop breathing during sleep, the dry mouth you experience upon waking may be one of several signs that something significant is occurring while you sleep and should be evaluated. The third cause is something that cannot be corrected with a better bedtime routine or simply drinking water. In some cases, dry mouth is not just a side effect. It is a primary symptom, a direct result of a condition actively affecting your body that requires specific attention. Diabetes is likely the most common and important example. When blood sugar is not properly controlled, it impacts every system in the body, including the salivary glands. Elevated glucose levels affect the small blood vessels supplying the gland tissue, limiting the resources needed for saliva production. The saliva that is produced may also contain higher glucose levels, essentially providing bacteria with an immediate food source inside the mouth. These bacteria thrive under such conditions. As a result, there is reduced saliva volume, potentially altered saliva quality, and an environment that supports harmful bacterial growth, all occurring at the same time. If you have diabetes and wake up with a dry mouth, these two issues are closely connected and both require closer evaluation by your healthcare team. Sjogren's syndrome is another condition that is often overlooked and deserves attention because the delay between symptom onset and proper diagnosis can span years, sometimes even a decade or longer. It is an autoimmune disorder in which the body's immune system, for reasons not fully understood, begins attacking its own moisture-producing glands. The salivary glands and the lacrimal glands, which produce tears, are the main targets. This leads to persistent dry mouth and dry eyes that do not respond to typical solutions, as the issue is not hydration or environment, but actual gland damage. Sjogren's is more common in women, particularly during and after menopause, although it can also affect men. Many individuals live with this condition for years, assuming they simply have chronic dryness and manage the symptoms without identifying the underlying cause. If your dryness is ongoing, does not significantly improve with hydration or changes in humidity, and is accompanied by consistently dry eyes, joint pain, or fatigue, it is advisable to speak with your doctor about the possibility of an autoimmune evaluation. Other conditions that directly reduce salivary function include Parkinson's disease, where neurological changes disrupt the autonomic signals controlling gland activity, rheumatoid arthritis, and other systemic inflammatory disorders, and nerve damage resulting from surgery or radiation to the head and neck. This type of nerve damage is, unfortunately, a common long-term effect for individuals who have undergone radiation therapy for head and neck cancers. HIV and other conditions that affect immune regulation can also play a role. In each of these cases, dry mouth is not the core issue. It is a signal indicating that a deeper problem needs to be addressed. Then there are daily habits and lifestyle choices that gradually worsen the situation and are often underestimated because each one appears minor on its own. Dehydration is more common in older adults than in almost any other group, and this is not due to neglect, but to physiological changes. The thirst mechanism, the signal that tells your brain to drink water, becomes less reliable with age. The sensitivity of the osmoreceptors that monitor blood concentration declines. As a result, you can be significantly dehydrated without feeling a strong urge to drink. Your body may be low on fluids without clearly signaling the need. If you are not drinking water consistently throughout the day, rather than waiting to feel thirsty, your body begins prioritizing how it uses the limited fluid available. It works to maintain blood pressure, support kidney function, and preserve hydration in essential tissues. Saliva production becomes a lower priority when the body is operating with limited resources. Alcohol also deserves clear attention because its effects are twofold. It acts as a diuretic, causing the kidneys to release more fluid than you take in. For example, if you drink a glass of wine with dinner, your body may lose more water than that glass actually provided. That systemic dehydration directly reduces how much saliva your body produces. Alcohol also has a direct drying effect on the tissues inside your mouth. If you have a glass of wine or another drink most evenings and then sleep for 8 hours, you begin the night already slightly dehydrated, with reduced saliva production, and then add 8 hours of sleep on top of that. The combined effect on how your mouth feels in the morning can be quite noticeable. Tobacco use, whether through smoking or other forms, gradually damages the salivary glands. It also alters the balance of bacteria in the mouth in ways that worsen the issues we've already discussed. Caffeine acts as a mild diuretic. A single cup of coffee in the morning is unlikely to cause major problems by itself, but 3 or 4 cups throughout the day, combined with low water intake and an evening alcoholic drink, can easily shift the balance. Highly salty foods pull fluid out of body tissues. Acidic foods create conditions in the mouth that saliva normally helps neutralize, but when saliva levels are already low, it cannot restore balance quickly enough. Now it's important to understand what happens if this situation is not corrected, because this is the point where everything changes. What seems like a minor morning discomfort can actually be linked to more serious health concerns. One of the most immediate and serious risks of ongoing dry mouth is a condition known as aspiration pneumonia. This needs to be explained clearly because it is not just a theory. It is not uncommon, and its connection to dry mouth is real, well documented, and often overlooked, even in medical settings. Aspiration pneumonia is a lung infection that occurs when material from the mouth, such as food particles, liquids, or even saliva, is inhaled into the lungs instead of being swallowed into the esophagus. The airway and the esophagus start very close together at the back of the throat. Each time you swallow, a precise and coordinated sequence of muscle actions must occur to guide material in the correct direction. The epiglottis covers the airway, throat muscles contract in order, and the vocal cords close. This entire process happens in less than a second and repeats hundreds of times each day without conscious effort. When saliva levels are low, the material being swallowed becomes less stable and less predictable, making it more likely to enter the wrong passage during that brief moment. In younger individuals with quick reflexes and a strong cough, anything that starts to go down the wrong way usually triggers an immediate cough that clears it before it reaches the lungs. However, with aging, the cough reflex slows down. Cough strength decreases as breathing muscles weaken. Swallowing coordination also becomes slightly less precise. As a result, the margin for error becomes smaller. When food particles or droplets of bacteria-laden saliva reach the lungs, they can cause serious infection. The bacteria involved are not harmless. In a healthy mouth, saliva constantly controls their growth. But when saliva is reduced, these organisms can multiply rapidly. Once they enter the warm, moist, oxygen-rich environment of the lungs, they can lead to fast-developing pneumonia. This is one of the leading causes of hospitalization and death in adults over the age of 65. It is not a distant possibility, it is a major health risk. Chronic dry mouth is a direct and preventable factor at the start of this chain. The second major consequence develops inside the mouth itself over months or years of reduced saliva. Because it progresses slowly, it is often ignored until it becomes severe. Tooth decay linked to dry mouth is different from typical cavities. It progresses more quickly, appears in different areas, often near the gum line and on root surfaces, and can become extensive. People who have had healthy teeth for decades may experience serious decay within 1 to 2 years after developing significant dry mouth. Tooth enamel, which saliva normally repairs through remineralization, stops being restored. Acid that saliva would usually neutralize remains on tooth surfaces for longer periods. The bacteria that produce this acid are no longer effectively controlled or washed away. These conditions allow decay to develop rapidly and aggressively. Unlike cavities that form slowly and are often caught early during routine dental visits, decay caused by dry mouth can move from an early stage to deep infection much faster, often catching people by surprise. From there, the impact extends beyond the teeth. Gum disease becomes more likely in a dry mouth because saliva normally helps regulate the bacteria that live between the teeth and gums. Without that protection, these bacteria increase in number. They trigger inflammation in the gums, which gradually damages the surrounding tissue and eventually the underlying bone. Teeth that have remained stable for many years can begin to loosen. Even more concerning, inflamed gum tissue does not act as a strong barrier. When gums bleed, they create an entry point. Bacteria from the mouth can enter the bloodstream, and once they are circulating, they can travel throughout the body. Research has connected oral bacteria to cardiovascular disease for many years. Certain harmful pathogens have been identified in arterial plaque. Ongoing inflammation caused by untreated gum disease influences markers across the body, markers tied to the risk of heart attack and stroke. Oral bacteria have also been associated with cognitive decline. This is not fringe science. These are well-established investigations, and at the center of it all is a mouth that is not properly protected, a mouth that becomes dry night after night while the person sleeping assumes it is simply normal. In more serious situations, a dental or gum infection can spread deeper into the head and neck or even lead to sepsis. Sepsis is not the infection itself. It is the body's extreme response to infection. It is a medical emergency with high mortality, even when treated. This is not meant to alarm you, but to present the full picture. What may begin as a small morning symptom can trigger a chain of effects that are far from minor. How far it progresses depends on the decisions you make today. Dry mouth also affects daily life. Chewing becomes difficult. Swallowing requires effort. Meals can turn into a source of stress. People begin avoiding foods that require chewing, such as steak, raw vegetables, apples, and dense bread, and shift towards softer, processed options. Over time, this change leads to nutrient deficiencies. Protein intake decreases, fiber drops, and essential vitamins and minerals become insufficient. Muscle mass declines, which in older adults increases the risk of falls. Immune function weakens, and energy levels decrease. Each of these changes makes a person more vulnerable to serious illness. There is also a social effect. Ongoing bad breath can cause people to withdraw. They may avoid close conversations, eat alone, or decline invitations. Social isolation can develop quietly, yet it is largely preventable. So what steps can you take? Hydration is essential, but not in large amounts at once. Salivary glands respond better to steady intake. Small sips throughout the day help keep them active. Keep water near your bed. Take a sip before sleep and again upon waking. Carry a bottle during the day. If you are over 65, do not depend on thirst alone. Use reminders. Oral hygiene must make up for reduced saliva. Use a soft toothbrush with fluoride toothpaste. Brush gently for at least 2 minutes twice daily. Use a tongue scraper each morning and floss every night. Avoid alcohol-based mouthwashes as they can increase dryness. Instead, rinse with half a teaspoon of salt in warm water for about 45 seconds. Chewing sugar-free gum or xylitol mints can stimulate saliva and help reduce harmful bacteria. Crunchy, fiber-rich foods like apples, celery, and carrots offer similar support. Your sleep environment also plays a role. A cool mist humidifier can reduce dryness overnight. If you breathe through your mouth or have sleep apnea, speak with your doctor, as proper treatment can improve oral health. Gentle massage of the parotid and submandibular glands in the morning and before meals can also encourage saliva flow. Daily habits influence saliva production. Alcohol, smoking, caffeine, processed or salty foods, and acidic drinks all contribute to dryness. Consistently limiting these can make a meaningful difference over time. Finally, professional guidance is important. Talk with your dentist about salivary evaluation, gum health, early signs of decay, and prescription options. Consult your physician about medications that may reduce saliva and whether alternatives or timing adjustments are possible. If dry mouth continues despite consistent efforts, prescription treatments are available. These may include medications that stimulate saliva, high-strength fluoride, and advanced artificial saliva products. Your saliva is one of your body's most effective natural defenses. It protects your teeth, gums, and overall health. What begins in your mouth can affect your lungs, heart, blood, brain, and overall quality of life. Pay attention to your body each morning when you reach for that glass of water. It is sending a clear message. Today, you chose to listen.